Today's episode of Trey Heart is being sponsored by Lucy the cat. And the letter A. Hello and welcome. You're watching the Trey Heart Learning Channel. My name is Ray Upchurch and I'm going to be talking to you today about atrial fibrillation. Now, I've talked to many patients and other people about atrial fibrillation, so I thought I'd like to explain this to you today. First off, what is atrial fibrillation? Well, atrial fibrillation is basically the quick beating of the top part of your heart. So your heart has really 4 chambers, but on the top side of your heart you have what you call the atria, and on the bottom side of your heart you have the ventricles. So what happens in atrial fibrillation is the top side of the heart is fibrillating or going faster than the bottom side of the heart. So let me explain this to you. Your heart has an electrical conduction system, and the main runner, or the part of the heart that causes everything to conduct the same way, is called the sinoatrial node. Now, I don't expect you to remember that, but for want of better words and a better way of looking at it, the sinoatrial node is like having the bass drummer in a band. Now, the bass drummer in a band, or especially in the marching band, is the one that sets the beat that the rest of the band walks to. So the sinoatrial node sets the beat for the rest of the heart. Now, inside the internal portion of your heart, all the cells that are inside are electrical conductive, and they can also form their own beat, but they typically follow the sinoatrial node. Now, what happens in atrial fibrillation is that some of the other cells that are around think, well, I think I want to be the main drummer. So they try to do their own beat. And the rest of the heart wants to listen to the sinoatrial node, but because these other drummers are beating along to their own beat, they can't always hear or pay attention to what the sinoatrial node is doing. So on the top part of your heart, it starts fibrillating. So what we're going to look at is we're going to look at a very quick video of maybe what the normal heart would be doing if it was beating normally. And so let's have a look at this. Okay, so that was a normal heart, or possibly a normal heart, probably with what it would look like. So if we had the atrial fibrillation going on in our heart, what would be happening? So let's take a quick look at another video that's showing what atrial fibrillation would look like in the heart. Okay, so we've looked at what a normal heart would look like and what a heart with atrial fibrillation would look like. So I've got a little piece of papers in front of me that I'm referring to, that's why I keep looking down. But so what are some of the causes of atrial fibrillation? Well, there can be a lot of causes of atrial fibrillation, such as high blood pressure, coronary artery disease, having a heart attack, heart failure itself, heart valve disease, or cardiomyopathy, basically a thickening of your heart. Other things that might cause atrial fibrillation are things such as hyperthyroidism, chronic obstructive pulmonary disease, having heart surgery or open chest surgery, and sometimes some other infective disorders might cause it temporarily. So, what I mean by that? Well, sometimes a person might temporarily get atrial fibrillation, such as after they have or when they have pneumonia. Now, obviously pneumonia doesn't cause everybody to have atrial fibrillation, but sometimes it might cause them to have atrial fibrillation. So, what are the symptoms of atrial fibrillation? Well, the most common symptoms that when they're present, and sometimes people don't have the symptoms of atrial fibrillation, but the most common symptoms of when they're present is you feel your heart palpitations. So that means that you can feel your heart beating in your chest. Sometimes you might notice that you have an irregular pulse, or somebody else might notice that you have an irregular pulse. You might also notice that you have shortness of breath, especially during physical activity, and you sometimes might feel weak, feel fatigued. You might have chest pain, might have some dizziness, might also have some confusion, and might have some lightheadedness or fainting or syncope. Now, any of these symptoms, especially if they're new to you, you need to report to your doctor. Fainting and syncope, obviously call 911 or the local emergency services within your country. Get emergency services out to you to help you. And so how is atrial fibrillation diagnosed? That's what I'm going to talk about next. What happens is when you go into a doctor, your doctor will obviously do a complete physical and assessment on you. And we'll check your vital signs and we'll check your pulse. And we'll quite commonly order things like EKG, stands for electric cardiograph, where they put some heart leads on your chest and we'll check to see what it is. And sometimes they'll send you for other things like x-rays just to make sure that there's no other complications going on from this disorder. This is typically how heart failure is diagnosed. Now, quite commonly, it is common for some patients not to have any symptoms. And so sometimes they'll go to a doctor for another disorder, and the doctor will notice that they have an irregular pulse and will do an EKG on them, and also notice that they have atrial fibrillation. So once the doctor finds out that you have atrial fibrillation, what is he going to do to treat it? Or what do they typically do to treat it? Well, there are several treatment options depending on what they feel is the cause. For example, you heard me talk about pneumonia. Typically, if it's resulted to an effective cause like pneumonia, once that infection is over, so is your atrial fibrillation, which is very good. It's very good for you, and it's very good for your heart to know that once these are over, that it'll happen. But your doctor will typically start you on, he'll treat the disorder first. If he knows of one that's causing it, such as hypertension, he'll give you antihypertensive meds. But the second thing he'll do is he'll usually start you on blood thinners. Now, in one of my other videos, I talked about some of the blood thinners, and there's a lot of new blood thinners coming out. You know, warfarin, Xarelto, some of the different things coming out. All of these things the doctor takes into consideration, you know, what has to happen. Some of the other things that would happen is that you would be referred to a cardiologist, and the cardiologist would look over you and see whether there's other treatments like electrical treatments such as ablations, or sometimes some of the other medications that could be used instead. So these are the most common things that are done for atrial fibrillation. So one of the things you can do is when you notice these symptoms, especially if you've been diagnosed with atrial fibrillation, if you notice these symptoms come on, you need to let your doctor know. You need to make sure that you always have somebody that you can contact, and so that if you have, you know, things like pets or whatever that need to be taken care of, just in case you have hospital visits, then you have a backup system. So basically have a backup system. So today we've talked about atrial fibrillation. We've talked about what it is and some of the causes of atrial fibrillation, some of the treatments of atrial fibrillation. The fortunate thing is that atrial fibrillation, there are a lot of different treatments out there, depending on what is the cause of your atrial fibrillation, and occasionally, if it's caused by an affective disorder, like I said before, there's no actual treatment that's needed. They might start you on an antiplatelet just until your heart settles down, just so you don't have any clots or anything like that to go on. One common thing that happens when some people have atrial fibrillation is sometimes people have strokes in relation to it. That's why they start you on blood thinners and other things and related to that, because they want to make sure that they lessen your chances of having a stroke that's going to be harmful to you. And so one of the things that, you know, if you have any dizziness, lightheadedness, any sudden symptoms of a stroke, remember the face. You know, if you have a weakness in your face, if you have, you know, weakness in your arms, if you have weakness in if you have difficulty speech, then you need to quickly call provider, call 911 and let them know, and to get you some help. So today, hopefully these explanations have been helpful to you. If you have any questions, please let me know. If you like what you see, please press the like button, and also please subscribe. Well, this is Ray Upchurch. I thank you for joining me, and I will see you again. Bye.